The diagnosis of prostate cancer can be scary. The issues are so sensitive and private, it becomes a bit challenging at times. Levity works, having them understand that they're not the only ones going through this, and it usually begins by having a patient who's been identified as having low-grade, low-volume disease who comes into our clinic and asks the question, do they need surgery? The question really is that all the cancer that the individual has, or is it just the tip of the iceberg? So here at Yale, the next step in the path to diagnosis is for that patient to undergo a multiparametric MRI. This is a special MRI of the prostate that allows us to identify areas that may actually contain high-grade cancer. Those that we feel as though have low-volume, low-grade disease, we would put on an active surveillance protocol. Active surveillance is not non-treatment. You're actually being followed very closely with PSA blood draws every 3 to 6 months, and then usually 1 year later, we obtain a repeat MRI and we obtain a repeat biopsy. One man I'm following with active surveillance has a relatively high PSA, but he has had 2 biopsies, 1 positive, 1 negative, and he's had an MRI, one that showed no regions of interest or any suspicious areas, and one that actually had 1 area early on. His life moving forward will be different because we'll have to manage his disease, but we will get him through that. And it's a very humbling experience to share that with the patient, with his wife, and let them realize that when they leave the office, they're not alone and that there's hope. I'm Peter Shulam, Chair of the Department of Urology at the Yale School of Medicine.